Hello and welcome to this demo of the Heroic Health platform. My name is Jaron and I'm a co-founder of Heroic Health. And as a registered nurse, I oversee the implementation of standardized health programs into this virtual family engagement platform. Whether you realize it or not, any health initiative is competing against today's attention economy, where top media platforms invest billions of dollars to extract attention, leaving people even at high risk for poor health outcomes paralyzed on screens so that advertisements can be pushed. Now we take preventive health programs like DSMES for kids with type 1 diabetes, and we automate that curriculum for kids in this 3D game and for parents in a companion app. And then instead of measuring time spent on screen, we reward these families for healthy behaviors. And we can customize the health behaviors that we push to these families based on their patient population. And that includes things like retaining in telehealth or in-person health programs, participating in preventive screening, and reporting daily health behaviors. And so as we go through this demo, picture someone who is just given a diagnosis with a chronic condition and having their whole family receive the Heroic backpack with a locked down Chromebook to run this 3D platform for the child, as well as for the adults to access their own health training in a simple companion parent app. And then families level up as they accomplish those key health behaviors. You'll see today a comprehensive diabetes education experience, but please know that we stand ready to automate any preventive health service, especially for better reaching rural populations or participating in value-based care. Now, this game you see here is actually 10 years in the making and has had over 10 million kids participate. And all of these superheroes in this Hall of Heroes represent a specific life skill that is delivered training to kids in public schools. And the data from this Heroic platform in public schools shows that kids who play this game for 23 minutes a day show up to school more often and have higher standardized state test scores. So this achievement gap being closed was performed without any extra work asked of teachers. And a few years ago, I approached the Heroic Learning platform and partnered with them to create a comprehensive learning experience for kids with type 1 diabetes that could be integrated into actual clinical workflows. You'll see that even the loading screens are opportunities to learn. And now please imagine a kid receiving their own lockdown Chromebook in the Heroic backpack to capture their attention and throw them into this comprehensive education experience that can do so much better than pamphlets ever could. Each district in this space represents a topic of diabetes self-management education. So here we've got physiology and the definition of type 1 diabetes. And these modules over here represent nutrition, taking insulin, mental health, and every other topic associated with this standardized program. And we break each one of these concepts down into simple little mini games. For example, the physiology lesson starts with chewing food, and that food goes down into the stomach, and they play a small intestine mini game where they grab glucose balls and drag them into the bloodstream. And as blood sugar goes up, they learn that insulin is how you actually get energy from the food that you eat. And all of this is part of the child's superhero training. Now, perhaps the most powerful part of this platform is how we allow kids to become influencers for good in their families. And that's done by allowing kids to push real world action right here from their game. So you can see from this game, the kid is reminding the parent with a task in progress by clicking this button to schedule telehealth appointments with their clinical team. And if the parent ignores this invitation, the kid does not receive their 5,000 Heroic coins. And this invitation can be repeated every single day. Now this button sends an email as well as a task in the Heroic parent app. And in addition to telehealth appointments, we also push for preventive screening, in this case type 1 diabetes screening for first-degree family members, for attendance to community events, in this case diabetes camps, and we reward kids for any exercise reported by them or their family members, even grandparents, when they wear the Heroic smartwatches that come in their Heroic backpack. And full reports of this child's progress can be seen from an educator dashboard by a clinical educator, who then performs regular telehealth check-ins. So how do we include parents and grandparents so we keep the entire family focused on their health initiative? Well, they get this simple family app, and you can see the whole family is accounted for here, and anything a parent or grandparent does in this app rewards the child in the game. You can see the task that was sent by the child right here to meet with their Heroic educator. And then adults can find their own education modules in the form of short 2-minute modules that are broken up even more into short mini games. And this experience can take even the busiest parent through a comprehensive standardized program, and if they stop progressing in the experience, the child in the game knows that they have stopped receiving coins and is notified to send an invitation right to the parent's app to continue their education journey. This platform, which is optimized even for low-performing devices, is how we bring health education and healthy behaviors into the attention economy. We can transform homes into their own preventive health centers, and we call upon health educators and public health leaders to utilize this platform to help families overcome barriers. Let's make healthcare heroic.